everyone. Welcome back. I'm Gabriel Allen Cummings.
And I'm Sonika Garcia, and this is Breaking the Code,
a podcast series by the Havas Medical Anthropology team. We're here to take the BS out of behavioral science by illuminating the why behind the what of behaviorals, rituals, and symbols that people take for granted. We hope to arm you, our listeners, with the tools you need to make sense of behavioral science and help you apply it to your work as communication extraordinaires. So hi, everybody. Welcome back again to Breaking the Code. I think this is episode 51, and I feel like I say this at the beginning of every episode, but this is a pretty special one. We're going to do something a little different. This is a bit of like a show and tell almost. I went to a Sickle Cell Disease conference last week, and Sonika has a few stories that she's going to share. We really want to have a conversation about pain as a presentation, and also how people interpret pain.
Yeah, I think that in our work, pretty often, always, but it seems like now more than ever, we are constantly studying this idea of chronic pain and what does pain mean, and as anthropologists, how does that differ? You know, in the US, obviously a lot of our work is global, so how does that differ amongst across the globe? And so I think getting into it, we were thinking, okay, well, what should we discuss? And we've thought about discussing this for a while, but then you going to the sickle cell conference, I always think there's no better research or topic, a way to cover a topic than actually hearing from the community. And you've been so embedded in the community with the work that you've done, Gabe, with the sickle cell community. So I think if we could just hear from you, like, you know, how was it? What stories did you hear? What surprised you? Like, I'm really interested to hear.
So yeah, I went to a conference in Chicago. No, I did not see a lot of the city. No, I did not try deep dish pizza. No, I did not see the bean. Although the bean doesn't make a lot of sense to me. I'm sure it'll make sense if I see it. But I did get a lot of work done, and I did get to speak to a lot of people. I think the first thing off the top of my mind is just like the sickle cell community is so warm and welcoming. I'm not someone who lives with sickle cell disease. So being able to go into their space, when I say there, I'm talking about the entire community, doctors, advocates, patients, people living with sickle cell disease, and being able to ask them questions, do our anthropological thing, being able to go there and come up with really cool stuff. I just feel a lot of gratitude to the community, and also just like, I want to honor the things that they have told me and the stories that they've left me with.
And I think that's a really important point to give you kudos to, Gabe, because it for any, you know, community that's dealing with a condition that, especially, you know, any community, but it takes trust, right? They're not just I'm sure they're amazing, warm, welcoming people, but to be able to really get to that level of like sharing, it takes that level of trust, and I'm sure they don't open up just with anybody. So I think that's a kudos to you for how you've built those relationships.
I mean, when you talk about trust, like that's the number one thing in sickle cell disease. When you have, first of all, a pipeline of, like, the pipeline is exciting now as far as the different treatments that are coming out and new. But for the last maybe 6 decades, it's been a lot of the same, and they've been largely ignored. Sickle cell disease in the United States is considered to be a rare disease, but every time someone mentions that it is, they almost have to caveat it with, well, actually, so many people have it in the United States. It's a largely Black population, but not just Black people get it. Just to kind of zoom out a little bit, because we're going a lot of different places quickly. Sickle cell disease, what it actually is an inherited blood disorder that affects hemoglobin, the molecule in the red blood cells that carry oxygen. And it's that lack of oxygen that leads to red blood cells becoming rigid, and that's that sickle cell shape. We could be here all day if I talk about every single thing that I got from the conference and every single thing that people told me. But as far as the conversation about pain goes, I really split for me into 2 different conversations. There's a conversation about acute pain, and there's a conversation about chronic pain. And even as we go through it, it doesn't feel like it's like 2 separate conversations, but really the idea that pain kind of exists on this spectrum, and not pain as people experience it as much as pain as we learn to understand it. And this is like a kind of a meta-analysis of me being able to sit and listen to people and attend exhibits and see the scars that people are going through. My interpretation of the pain that they've gone through, kind of just like getting a better look at what's easy to understand and what's not. And so when we start with acute pain, that really comes with the vaso-occlusive crises that occur in sickle cell disease. So I was just talking about how they turn into the sickle cell shape. That's the shape of the cell. And so what happens is that they'll clump up at different parts of the body, and it's different parts for different people. And so these crises are just like a part of your body is not getting enough blood flow, not getting enough oxygen. Organ damage is something that happens too, but it's those really serious events that they call those vaso-occlusive crises. And I actually want to stop here, Sonika. I don't know how much you know about sickle cell disease besides what I'm going through, but I just like, as far as we go for anthropological, I keep using that word, but like when I say the word crisis, what triggers in your mind? What do you see? What is happening? What's going on? And what needs to happen after?
Well, I mean, just that word alone, it's like hysteria almost, like this, obviously pain, like outward pain, a hospital visit, like an event that is observable and that you see someone in pain, screaming, the whole thing. That's how I think of a crisis. Is that like that's not right?
No, I'm not going to say that's not right, but I think the important thing to be clear about is like our image of what a crisis is, and then what a crisis actually looks like when I'm having conversations with people who have been through these harrowing crises. And again, I am reading back what I've heard from the community when they compare it to car accidents, when they compare it to glass being in your bloodstream, when they say it's worse than childbirth. These are things that open my ears to like, I will never give birth to a child, but I understand the magnitude of pain that you are going through in order to make that comparison. And so, yes, it is going to be screaming sometimes, but sometimes it's just going to be you're on the floor, covering your eyes, not making a lot of noise. One of the most interesting conversations I had is about the media's depiction of sickle cell disease. And there's a bit of like two sides to it, where one side is like any representation is good representation. If we're showing people screaming and being hysterical, that is one way that people with sickle cell pain present their pain. I just want to be very aware here. It's not a right way or a wrong way to present the pain. It's how the pain manifests and the expression that comes from it. And so there are some people who will end up in the ER and with these crises and, hopefully get the treatment, but oftentimes not because of, again, that word trust that we were talking about before. But what was interesting to me is that somebody was talking about a crisis they had, and they were just like at work, like having a crisis, and it's totally inside of their body. And I think this gets to this idea that I was trying to get to before, this idea that pain, as we see it, as people who don't experience it, exists on this spectrum. People are in pain. Someone is having this crisis, and they're just sitting across from you on a call at work. They're just, holding the camera and doing a shoot.
And
That
especially
to
the way
me,
that you explained it. I mean, right? Like you're not just like laboring if you're giving birth and it's like, no big deal. The media and they depict that in a certain way. And I think that the fact that people with sickle cell, living with sickle cell, are suffering sometimes silently in the world is really wild, to be going through that much pain and not be able to, show it, I guess.
yeah, and it's the social implications of showing weakness and everything
Yeah.
like that. Things that like, and I think one of the most fascinating things about sickle cell disease is that there's a lot of hope around the community by like HCPs and pharma companies and everything. And I think it's because people can see the human issue. And so
Yeah.
when we're talking about having to suffer in silence, I think that's something that everybody can relate to in one way or another. Not to say that I experience the pain of someone with sickle cell disease, but they are very human issues that go on in this space, that go on as we talk about chronic pain. The idea of having to suffer in silence is one of those big ones.
Yeah. Something you said that was interesting that I just want to maybe a clarification on. So when you said that there's no right or wrong way to show it because everyone, it looks different depending on the situation, depending on the person. The community is just happy to see it represented at all? Is that what I'm hearing? Do they feel that sickle cell is not actually being portrayed, not only the way that it should, but even to like the frequency that it should be? What's going on there? Is that a concern with the community?
Well, it's interesting because that's the split, right? So there are some people who are like, any representation is good representation. And then there's another side of it where it's like, you should be getting this right the first time. And by getting this right, it is showing that diverse span of how people go through pain. It is going to be people coming into the ER, just screaming out of their mind because they're in pain. But it's also going to be people just like curled up in a ball, unable to speak because of the pain that they're in. And like, both are valid. Both could be what we consider tens, but it's, the depiction of one is a lot easier to empathize with, or sympathize with, I should say, than another. Yeah. So someone screaming in pain, like, we are registered to say, oh my gosh, somebody's in trouble and they need help. Whereas somebody who's kind of curled up to themselves, silence, I mean, we'll just leave them alone. Maybe they just need a little bit of space, even though it could be as severe in both cases.
Yeah. Yeah. It feeds into our programming for how we legitimize pain, because, we just have these visual representations of it being a certain way. And yeah, so that's really interesting.
Totally. Which takes us nicely into a conversation about chronic pain, because sickle cell disease is a lifelong condition. It's inherited. You have it from the moment you're born. And so this idea of chronic pain, it's that these crises that people go through, these acute vaso-occlusive crises that affect their organs, that are destroying their organs from the inside, like the organ damage is something that will lead to chronic pain, the immobility, the difficulty walking. One of the things that I attended at the conference was an exhibit where it had pictures of people with their scars related to sickle cell disease. And it really painted a picture for me that sickle cell is a whole person disease, that this pain that I was seeing, interesting because it was pain in objectivity. There was no story associated with it. It was just two scars on somebody's hip, some scars on somebody's chest, a scar on somebody's eye. And they came from different things. One's from hip replacement surgery. One was from someone who was attacked while they were having a sickle cell crisis, those harrowing crises that we were just talking about. Somebody was attacked during that, and that is a scar as a result of sickle cell. And to bring this all the way back to a conversation about chronic pain, there are layers to it. So it's the physical damage, it's the physical immobility and difficulty moving. But I mean, Sonika, I don't think we can mention a conversation about the pain that's difficult to see without talking about mental health. And I think one thing I want to highlight, particularly in sickle cell disease, but it's likely to be a truth in all inherited diseases, is the idea of parenthood. One of the challenges that parents face when they give birth to children with sickle cell disease, first of all, when even looking for a partner, it's like, who's going to be able to support me when I have these crises? It's taking the crisis, it's taking the pain as a subjective thing, which is so fascinating because it's often spun one way or another. It's either super empowering and you're just super strong because of it, like we talked about that episode with cancer and you're a hero and everything like that, or it's the other way where it's like it's super devastating and we can't imagine you living life without it. But it's really, it comes down to these practical decisions. I think it's one of my favorite things, being able to learn from people with sickle cell disease, is how practical they are in the face of this very painful disease. It's, yes, I'm in pain all the time. Like that's just what it is. Yes, I need a partner who's going to support me. And yes, I have some trepidations. Some have some trepidations when it comes to giving birth to children. I mean, it could lead to guilt. This immense guilt and I'm not a parent, but to have a child who was born sick. And I think I'll just say this thing and then I'll pause. One of the things that people with sickle cell disease are often told when they're young is that they have an quote unquote an expiration date. This is the phrase that I've heard so often, like more than anything else, like a universal experience appears to be this idea of an expiration date. And this is something when it's like, you're 18, you're 25. I'm sorry. Let me say that really slowly. You hear about it when you're young, and the expiration date itself is you turn 18, you turn 25, and that's it. Like your life is ending. You're going to die at that age. I'm going to pause there, Sonika, for any reactions. I see you reacting to that.
Well, yeah, I mean, first, I get, this is just me not knowing, but like,
yeah,
what is like the life expectancy of someone with sickle cell on
In the
average?
United States, the life expectancy is, I believe it's somewhere at 50. It's still
Okay.
somewhere much less than the average, which is in your 70s. But to be told that you're not going to live till 18, you're not going to live till
Yeah.
21, it is such a damaging effect. And if you want to talk about chronic pain and really like starting life off on the wrong foot,
Yeah.
these are conversations that I'm having with people or panels that I'm attending where people are saying, why am I going to high school? Why am I going to college?
Yeah.
I could have all the good grades when I'm 18, but if the doctor said
Yeah.
I'm going to
Yeah.
pass away at 21, I'm not going to go to a 4-year university. And so
Mm-hmm.
it's one of those things where it's like people who live to 21, and I'm talking to people who live to 21, clearly live to 21, beyond 21, have children, everything like that. It's,
Wow.
some of it is picking up the pieces of a life that I didn't expect to have. And it's in those ways that chronic pain is not just something, it's like, where does it originate from,
Yeah,
really? And
exactly.
tracing that origination all the way back to that one conversation that you had when you were 5 years old or something like that. I think it's one of the things that it's difficult, again, in this spectrum of how can we see this pain, it's difficult to see and continuously relate to.
Yeah. Well, so I was going to say, and I think this brings us really nicely into a larger discussion around pain. So, like the pain itself, there's the physical pain, which is originating from the condition and what's going on in your body that's causing you to have these crisis episodes and the pain that comes from that. But when you are someone living with a chronic condition, you're dealing with that pain, but then you're also dealing with the pain of like that just like festers over time of believing that you're not going to live to a certain age. You still have to live life just like everyone else. And then those life experiences end up weighing on that pain. So eventually in life, what ends up getting blurred when you're living with a chronic disease and when you're living with chronic pain is that the line of like, what is the pain from the condition and like logically what's going on, and then what is the pain from like the social effects of having chronic pain. And I think that that's even more compounded in sickle cell, especially if you're then on top of that told you're not going to live past a certain age, then that's like times all of that by 10, because how do you even live your life like with that on your back? So I think that that's, it's interesting. We oftentimes focus, in the US on the pain from the physical pain. And we do talk about mental, right? Like we talk about the mental burden, but I don't think we often talk about like the actual manifestation of that burden into pain. We kind of leave it in like a space of, mental health, mental burden, depression, anxiety, and it all still lives up here, but up here translates to the rest of your body. So I think even being able to quantify the pain physically that comes from mental, I think is something that we should be talking about more. And in fact, like other cultures and communities across the world do legitimize mental pain as pain that can then be physical. So it's a cycle, but yeah, it's very interesting.
Yeah. I mean,
Anything
I
else
want to,
from the conference?
I could go on about the
You can go
conference
on it.
all day, but
Yeah.
I think two things from what you said are really important to highlight. It's the idea that chronic pain can accumulate, and like over the course of time, it's not going to be like even, and I think this is something I'd have to, next time, if I ever get an opportunity again to go out there, it's like, is a 4 this year the same as a 4 in pain next year? Or is it, I've adapted to more, I'm used to more? I think the idea of the accumulation really comes through, or it's most clear when we talk about the organ damage. These are the same organs getting, I'm going to use the word again because this is a word they use a lot, destroyed by these crises. The second thing I want to bring up is when you brought up mental health. I think that, like you said, mental health is kind of like, as we've said, it's difficult to see. But I think what was so illuminating was they were able to explain a thought that led to what damages mental health. oftentimes it'll be like, oh, the mental health burden, like it's just
Mhm.
difficult, life is hard, like, and kind of ambiguously,
Yeah,
but
that's,
like
yeah.
the beginning to end thought, the beginning conversation of you will not live to X year, and then
Hmm.
how that affects someone's literal life. Like, this is mental health in practice. I'm
Hmm.
just making the decision not to go to college or anything like that. It's not, again, and when we talk about mental health, it's not a deficiency. This is how the catalysts, the things that have affected my mind and come into my brain, have affected my decision making. I was told this thing, and so now here's my expectation of my life prospects because of it. And so those are just two things I wanted to highlight as I put a bow on the sickle cell experience and everything like that. I definitely have
Yeah.
to make my way back to Chicago again to see all the fun stuff, but I will say it was an action packed, really good time.
Great. No, that's awesome. And also just very interesting. I think from an anthropological lens, as we kind of were talking about, and as you supported the fact that this community is able to pinpoint sources of mental pain, and then I that's really fascinating. I was to prepare for this episode just looking into ways that other cultures talk about pain, but like I'm just more interested in pain outside of the medical. Sure, like you maybe have a medical condition, but like how else does pain manifest? How do people talk about it? And I think whenever we're trying to like dig into a topic, we've talked about this on many episodes, but language is a really important key into the mind, more so than behavior, I think. Well, yes, more so than behavior, but it tells us a lot when the way that people talk, the phrases that people use. And I found these two really interesting stories. One was they were doing an ethnography study in Nicaragua and like a village where they were asking women about health and things like this. And they use a term called brain ache. They call it, I don't want to mess this up, so let me just refer back to it. Dolor de cerebro, which translates into brain ache. That's how they say it. They made it a point in the interview, these women, to say, we're not talking about a headache, just to be clear. We're not talking about a medical headache as you would categorize a migraine or a tension headache, how we would here in the US. It is a physical pain in like the back of their neck, but it's something as a result of life stresses. So like the fact that you have to support a family, the fact that one day you had to do hard labor, the fact that one day maybe you're going through some sort of crisis in your household that is causing mental anguish. Like these things that they're saying, it's this continuous pain that we feel sometimes in moments of intense social, like outside of, there's nothing wrong with me clinically, but there is stuff going on in my life which is causing this brain ache, and that is different than how we're going to talk about a headache, how we would all just talk about a headache that maybe is caused because you get migraines and maybe there's something clinically going on there. So I thought that was fascinating because they talk like, oh, what's wrong? Oh, I have, a brain ache. And it's like, oh, I know now that when you say that, it means that something's going on in your life. And that is legit. Like, I can't imagine being like, I have a headache. And then someone say, like, every time I do say that I do suffer from headaches, it's like the response is always, oh, do you get chronic migraines? Like, do you have a migraine? And it just, you automatically go to this place of, oh, what's clinically wrong with you? Like, not, I do that to other people too. It's not a fault. It's just the way that we think in the US. It's always, I have a backache. Oh, is it because you have sciatica, or like what happened? What happened for this to happen? So, and speaking about backache, it brings me to the other story of like just the way that we talk about pain. So like here in the US, we say, I'm having pain, or I have pain. And in other cultures, I think this was more Southeast Asia, another ethnographic study, and people say, pain came to me. Like that's the
Wow.
English translation. Pain came to me. So it's like already saying, yes, I have it, but that's not the focus. The focus is that something happened and it brought me this pain. Again, refocusing on what's going on in the environment to maybe have caused that pain, and legitimizing that as something important. The pain that I have is one thing, but what's more important is to talk about what caused it. And that I felt was was very interesting in the way that people speak about it and how that's so different than how we speak about it in America. So, and I think so much of that ties to the sickle cell community, right? Like they are living with this, and sometimes I'm sure their pain is compounded because of just life and living life with this. Not that you're even having a crisis, but just the fact that you have to move through life every day and all of the things that we know life can bring with this huge added burden of disease. And sometimes that pain is just from that component of it. So yeah, I thought that was fascinating.
I think it's fascinating too, and you're spot on with the sickle cell example. I think back to either it was what I just went to in Chicago, or I was fortunate enough to go to a conference in Orlando, and one of the panel discussions, or it wasn't even a panel, but somebody was up there talking about like the language that's used in conversation with doctors. And so this woman, she was a physician, and she also had sickle cell disease. And she was saying, when the doctor asks me nowadays, what caused your crisis? She responds with, I was conceived. This was to make the entire point that you can't use this blame language when you're trying to explain this pain that you will go through at some point in your life.
Yeah.
I think it's so fascinating because, and this goes to a broader point about the community itself and how giving they are back to themselves and to the children to pay it forward. Mm-hmm. The point she was making there is, I've had conversations with doctors and I felt guilty about the pain that I'm going through. We cannot have our children growing up in a world with sickle cell disease feeling guilty about them having a crisis, feeling guilty about them, going through this pain. Again, it goes back to the objectivity that they're able to look at situations with. That's so fascinating. I think it's something that I need to, as a researcher in this space, internalize and be able to understand when it comes to applying empathy. And this physician was actually saying, like, I jumped in the pool, I came out, I had a crisis, and I learned next time what to do about going in the pool. It's not never go in the pool again. I think that's another interesting thing when it comes to like the language that's used, particularly around children, just to help them grow up with this disease, with the acute pain and chronic pain that will likely come. Mm-hmm. It's making sure that they don't feel like it's their fault. So I think that distinction you gave there, I have pain versus pain has come to me. Mm-hmm. I kind of like pain has come to me more than I have pain. Like
I'm going to start saying that 100%.
Yeah. Pain has come to me. Like I was just doing fine. And then pain showed up.
Yep.
Like it's not my fault. I really like that because it speaks to that whole, again, the things that are easier to see than the things that are harder to see. That burden. I don't need an additional burden to say like, oh, I did this thing and I caused myself to be in pain. Like, why does it have to be my fault when I am engaged just living with this disease? And it's the emphasis on the word living, because I'm just doing things. I'm just living life. And I just so happen to have this disease, which is the thing that's causing me the pain. It's the disease. It's not me. So I think that example and tying it back to sickle cell, you're spot on.
Awesome. Well, thank you so much, Gabe, for sharing all of that. I mean, obviously for attending the conference and for sharing about the community, because I think it's going to be really valuable for people to listen to. Well, if there's anything else and you guys have questions on Gabe's, obviously he said that he could share a lot more. And if you have any questions for him, definitely reach out. Cause I mean, I definitely get to talk to you and I can pick your brain whenever I want. But if our listeners, want to reach out, please do. And again, thanks for sharing and thanks for listening, everyone.
Of course. And thanks for listening, everyone. I think this conversation about pain is one that's ongoing. And so this idea of how we see pain is something that we'll definitely have to revisit in a future episode. I think we're beginning to get at something here, though, with how pain is understood by other people.
Agreed.
Yeah, any questions, reach out to me directly. medicalanthropology@avos.com is our mailbox. Yeah, we can wrap up there. So for Breaking the Code, I'm Gabriel Allen Cummings.
And I'm Sonika Garcia. Thank you.
Thanks, everybody. Breaking the Code is a podcast created by Havas's medical anthropology team. Hosted by Sonika Garcia and Gabriel Allen Cummings. Produced by
Tiffany Tang, and inspired by all of you. Thank you for listening and for your continued support. If you enjoy these episodes, we would love to hear from you. Please leave a rating, subscribe, and send us a message to our mailbox, medicalanthropology@havas.com. Till next time.